So I'm Jazz. I play a couple different roles in the PT program in the School of Rehab Science at McMaster. So I'm the acting director of clinical education, as well as I teach the clinical skills labs there. And traditionally, our clinical skills labs are a combination of development of interpersonal skills and communication, as well as some technical skills and case-based discussions. So like many of you, we were caught kind of mid-unit teaching our clinical lab skills in the COVID era and had to, do some quick contingency planning, be relatively flexible and nimble, and then figure out what content that was remaining in that course curriculum could be taught in a meaningful way to learners, but in a virtual platform. So different than what we'd traditionally been doing, because clinical lab skills have typically been very little didactic and much more interaction. What we did as a team was we essentially looked at the essential competencies that we wanted to ensure our learners were meeting. And I think this is the PT essential competency profile, but it's pretty, I think, standard. There's a lot of consistencies or similarities across healthcare practices. So when we look at a lot of these competencies and what we want our learners to look like by the end of the program, we can see that communication, collaboration, management, expertise, a lot of these can be developed if we're creative and innovative and fostered in a virtual platform. So that was the starting point to ensure that we were still meeting some of these milestones when we weren't able to deliver in-person teaching. So when our team kind of looked at what content we could deliver online, but still grasp that clinical reasoning. And clinical reasoning is really the foundational skill that we want our students to learn in the clinical reasoning labs. And I'm a clinician. I've practiced for about 18 years, and I'd say a good chunk of the skills that I've developed and learned and continue to use in patient care is clinical reasoning. So there's lots of different clinical reasoning models out there, but really just acquisition and collection of information from a variety of sources, hypothesis generation, testing, refuting the hypothesis, and then some reflection on personal biases, and pattern recognition. So we really wanted to take this hallmark skill and make sure that we were still consistent in trying to teach clinical reasoning in a virtual world. So there's a couple of different ways. A lot of the things that Dorothy and Justine have talked about are areas that we've integrated into our courses as well now. So not the webcam though, Justine, I'm totally going to use that idea. We were more so recording videos and doing slow-mo, but I love the webcam idea because it allows real-time discussion to occur. So that's fantastic. But the standardized patients, the virtual standardized patient interactions, as well as, the modified OSCEs are all strategies that we've tried in the physiotherapy program as well that have been working well and have received some good feedback from the students. So a couple of the ways that I wanted to show you around how we can still incorporate some clinical reasoning in a virtual world. So I'm going to give you two examples. The first one is by using videos and polling. So we found that students like to have continuous engagement, and this is more towards talking about the lectures or turning our labs into online. So during the online labs, I'm going to share with you a couple of strategies that we've used. Very often in a real in-person lab, we would expect students to be introduced to a concept, an outcome measure, some type of skill that we wanted them to do, potentially use their observation skills, interpretation skills to be able to reflect upon what they were observing. So I'm going to give you an example of what we did in one scenario. So for one of our labs, we were introducing our students to the community balance and mobility scale, and in a in-person setting, what they would have to do is pair up with partners and then go through and administer this outcome measure. Seeing that many students did not have the ability to work on their peers or have someone around them, what we did is we uploaded videos and then used polling to get that same skill set across. So this would be an example of a video. It's my husband that was generously agreed to be my model there. And then we just asked the students, there's what we're asking the patients to do with the standardized instructions. And there's a timer on the bottom. We would ask students to use a stopwatch because this specific skill required it to be timed. So I'm going to play this for you. So what we would then do, and Teresa, can I get you to launch that poll? Oh, I've got the poll here. Okay, perfect. So then can everyone see that poll? Justine, I can see it. So if I can see it, shake your head or nod your head if you can see that poll. Perfect. So then what we would ask our students to do is then just rate that based on the community balance and mobility scale. So we would have done videos as well as polling. So this would mimic what we would ask them to do in a real lab setting. So then we would ask students to complete their answer, submit their answer, and then we would share the results and have some discussion with the class.
People can go ahead and answer the poll so that I can close it.
Oh, okay.
I
think it's, yep. Okay, perfect. And we don't need to share the results, Teresa, but I don't expect everyone to know the community imbalance mobility scale in this group. But so that
I
would just
foresee
be
some people didn't have a stopwatch out, so they might be just guessing. But
yes.
All right, so like it'd share like this, and so you could take up the answer if there was disagreement as to how long it would be. You'd be able to have that discussion then, right? With the share the results like that.
Perfect. Thank you, Teresa. So then what we would do is we would share the results and we would see where there's discrepancies. Usually there would be, one or two answers that would be close. And then we would find out from the students, what made them think a certain way. Another example where we use this was, so Teresa, I'm going to close the poll here now. So another lab that we did this for was in pre-COVID era, we would have babies come into the lab and our students would use the Alberta Infant Motor Scale and, be able to scale mobility on different age groups of children. So we use the same format. We use videos, video clips of babies, as well as polling functions to be able to capture those same skills. And we also did that with functional movement assessment with patients that had sustained a stroke. So that's been quite successful with good feedback. The other thing you get with polling is the student engagement. They feel like they're actually engaged, they're interacting, and you can see how many people are interacting because you'll be able to get the percentage of people that have communicated with that poll as well. So the other thing that we have found extremely valuable, and which is a skill set that we would do in person anyways, is case-based discussion. So when we have the opportunity to use standardized patients, that's great. Unfortunately, the resources are not always there to get a trained standardized patient. So we have used role play with our students, so case consolidation, so our students become the standardized patient. So half of the class would get a specific case, and they're provided that case subjective history in advance, as well as the objective exam findings in advance. They're also given a bit of an orientation, and then students are asked to break out and perform a subjective history and then plan out what their objective exam would look like. So like we said, with clinical reasoning is one of the major skills that we want students to garner from our clinical skills lab. This is something we can absolutely still maintain and get when we are teaching in a virtual platform. And actually what we found is that very often students that aren't typically contributing in a real life in-person situation, they often feel more comfortable contributing in a virtual situation if they're given the opportunity to do so. So some of the questions we would use, some of the prompting questions would be to, give a patient a case scenario, or they're a student's given a case they have to role play. The student that's role playing the therapist would have to perform the subjective history, come up with hypothesis generation, and then think about their objective examination. And to do this, we find that it's difficult to do. We have classes of upward of 60. So we usually do breakout rooms to actually do these skills. And what we ask students to do is think of hypothesis generation like buckets. We've used buckets with kind of the drops in the bucket model, or we've used kind of the poker chip model to think about your findings and what findings would contribute to specific clinical diagnoses. So what we're going to do now is we're going to try these breakout rooms. There's a couple of pros to the breakout rooms in that you have the option of pre-assigning their groups. So you can pre-assign if you have groups that are already working together. You can have random allocation of groups. You can have groups of 10, 15, as small as groups of 2. So that allows you to have a lot of flexibility in the skills that you want to the skills that you want to acquire, as well as the conversations and discussions that you want to take place. There's also the option to have annotations and a whiteboard in your small breakout group sessions as well. The one downside is that once you go into breakout rooms, they're not recorded. The other thing that's lovely about breakout rooms is that the host, and I believe the co-host usually, if you're given the option of being the co-host, is that you get to hop in and out of the breakout session. So it's similar to you being in an in-person environment and then just popping your head into a room or popping into a group to make sure that they're on track if there's any questions and to help facilitate that discussion. So we're going to, I think I have the breakout room. Teresa, do you know if I have the
I have
room
it, so I'll just set it up. Mm-hmm.
Perfect. So what I'm going to ask you to do right now, we're not going to talk about a case, but maybe once you break out, and Teresa will decide how many people she'll put in each group. And then maybe, Teresa, I'm not sure if I have the opportunity or functions to be able to hop in and out of each group, but if not, then if you can, just to show the group what that might look like. And a couple things you might want to chat about while you're there. What program are you affiliated with? Maybe what did you have for breakfast? If you're going to describe yourself as an ice cream flavor, what would it be? And maybe any pearls that you've learned from online teaching of clinical skills. We'll only break out for a couple minutes just so everyone can see what it looks and feels like.
Okay.
So we can go ahead with that. Teresa.
Opening up the rooms now.
So I think people are all returning back to the main session, which is what happens. It's nice. Feels like big party again. So just hopefully if you've had the opportunity to use breakout rooms, then hopefully you've seen it as a really great add-on to Zoom. It really provides the opportunity to have discussions in small or large groups. And it really allows students to engage. And as a moderator or facilitator, it gives you the opportunity to join in and out of groups. So some tips and tricks I've learned along the way. By no means am I an expert, just have had a really long learning curve over the last 5 months. Like Dorothy did when we started this meeting, I think, and Teresa did, I think it's really important that you set housekeeping and ground rules for your students so they know how to engage, whether that's going to be raising their hand, using the chat function, or using a reaction. I think all of those things are important to establish how a student can actually engage. Use a variety of platforms. So I like to use a combination of videos, small groups, large groups, as well as polls. There's neat little things that you can find on the internet, like Answer Garden, where you can have questions where you can create a word cloud, or Kahoot is like a multiple choice function that turns in, it's kind of gamification of some of the content. And it's almost like, I feel like when you're using a variety of platforms, it's like getting students to move around in a room. They feel like the lab is actually moving. So it really does mimic what an in-person lab might look like. And give mind and body breaks, just like you would in real life. So, you know, if we have 3-hour labs, so you really need to allow your students the opportunity to move. And then I would usually add brain teasers or something during the break to help students socialize during their breaks, just like they would in a real life situation, which was really helpful, and the feedback was great. So I'm going to stop sharing. Thank you, Teresa, for allowing me the opportunity to share some of the tips I've learned along the way.